everyone, I'm Dr. Tabitha Samir, and today I'm going to be going over under eye filler, which is the hollows under the eye, how to fill it, and what you should be looking for in a practitioner if this is something you would like to have done. So today we have Bianca, and Bianca has had really hollow under eyes since childhood. And you can kind of see here where you see that hollowness in her tear trough. So we're going to fill this area, and also she does have some mid-cheek loss of volume, which is what I call a pseudo tear trough. And oftentimes the hollow under the eye can also connect right into that cheek. So we're going to correct the hollowness under her eye, which I call the tear trough, and the hollowness in her mid-cheek area, which I call the pseudo tear trough. Both of these areas are treated differently with different types of filler. So when you go see your practitioner, make sure that you talk to them about these differences. This area can be difficult to treat, as I mentioned, because the area is so thin. So it really is good to do this in steps. The best way you can ensure excellent results is actually by underfilling. And that's because if you need more filler, you can always come back. And also because the filler that we put in this area, the types of fillers that we use, which are hyaluronic acid-based fillers, are hydrophilic, which means they attract water. So once they're injected, they can actually expand, for example, in mornings when people wake up with under eye puffiness. So the key is to go to somebody who understands this. Undercorrecting is the best way to achieve excellent results. Another reason it's important to go to an experienced injector is because this area is so thin. Sometimes when people place the filler too superficially, you can actually see the filler through the skin, or it can actually cause a bluish lighting effect, and that's when light hits the eye and it's refracted out in a bluish tinge, which is called Tyndall's effect, and it's often a result of putting filler too superficially. So the first thing I do is clean the under eye area thoroughly to help prevent infection. And then I measure out the hollows of the under eyes and the area where I'm going to fill using the golden ratio or the golden mean. And that's a mathematical measuring concept that allows the most aesthetically pleasing proportions on the face. Next, I'm going to be adding a little bit of lidocaine to the area to make it comfortable for the patient. I will be using a cannula to inject filler to the under eye area. I like using a cannula instead of a needle because using a cannula can result in less bruising and swelling in this highly vascular area. And that's because cannulas are blunt, so they weave around blood vessels and tissues, whereas needles are sharp and they cut through blood vessels and can cause more bruising and swelling in this thin vascular under eye area. Okay, so what I did is the sandwich technique where I put Restylane into your cheeks where you had those pseudo tear troughs, and then I was able to put Belotero underneath right above the bone and then on top of the muscle to be able to increase the volume of those under eyes so they're not as hollow. And then let's have you come back in a week or two just to make sure everything is looking the way you want. And at that time, if you feel like you want to do more, we can. But I think you're going to be very happy with the way this looks. You ready to look and see what you look like?
Yes, please.
Okay.
Oh my God.
Yeah?
It looks so good.
Yay, I'm so
Thank
happy
you so
you
much,
like it.
Dr. Moon.
You're so welcome.